Moving from goals around reducing pain to functional goals is a really important concept for physiotherapists to adapt when discussing treatment plans with patients. So many patients, they come to the physio clinic because they're in pain, because essentially they're in this place of trying to survive. And a really great reframe, I find, and an excellent way to be able to reframe goals for patients is this concept around moving from pain centered to functional centered goals in order to change the context, right? From a patient who might be, again, in this sort of place of surviving to then thriving, to have something to look forward to. Hi, my name is Eric, also known as the Functional Physiotherapist, and thanks for visiting my site. My purpose and passion is helping to support physiotherapists moving from more of a passive to an active approach of really helping and empowering patients. Today, I want to talk to you about the importance of functional goals for patients. And again, moving back to this place of thriving. And I really think, it's an important concept around this concept of empowering patients when it comes to functional goals. That, we're going to try and we're going to have a vision towards getting you back to as much as possible, back to a place that you feel comfortable with in terms of, again, a specific goal you'd like to achieve, versus, again, coming out of this place of more of a passive approach and a dependency approach to coming to see the physiotherapist because, hey, I'm in pain and so I need the physio to fix me, versus, I've got these goals that I want to get towards, that I want to achieve, and I want to thrive in a way that doesn't necessarily have any sort of power with regards to the pain that I might be experiencing. And again, this reframe around the goal. So much of the patients that I've seen in the past, when the goal is looking at reducing and getting rid of pain, it really limits then, again, this idea of what the rehab process might look like for the patient. And as I mentioned, it sort of disempowers the patient. It takes away that active approach around what the patient is looking to achieve beyond the reduction in pain. And so, again, I just wanted to use this opportunity as sort of a reminder for physiotherapists that although, we want to chart, obviously, and kind of know where a patient's pain level is currently, and again, it can give us an idea of how aggressive or non-aggressive we can be as a starting point. From a big picture perspective, it really makes a lot of sense to go with more of this patient goal, functional goal perspective in order to, again, have the patient have a different relationship to what they might be experiencing in terms of their discomfort. And again, really getting to this place of focusing more so on improving their functional capabilities versus this dependency on pain control. Also, if you're a physiotherapist who's interested in learning more about these active rehab approaches, I do have an online course which it talks further about this idea of moving from passive to powerful in terms of, again, more of this active rehab approach to really helping patients and empowering them in an active rehab process. Thanks again for watching, and please like and subscribe. And also, please leave a comment below if you have any questions or concerns. Have a great day. Take care.